Exactly. I mean, wouldn't it be wonderful if every doctor would learn how to teach their patients visualizations, just or
Mm.
meditation, or just like a simple thing that you come home with other than a prescription or a pill and say, oh, wow, this is actually something I can do for myself. I mean, that would be fantastic. If this comes from a doctor, that's the thing about the authority, patients would react even more strongly because, oh, the
Exactly.
doctor said that, so I'm going to do that. That's going to help. I mean, that's a placebo effect. And in
Exactly.
some ways, this is what I think medicine doesn't really get yet, that these extra 5 minutes invested could increase their, healing rate dramatically.
Yeah.
So we have
Yeah.
to talk more often.
Totally. And it's interesting also that you say that because actually we're just starting a whole new campaign, and that we're calling lifestyle prescriptions.
Mm,
Where doctors actually, and my total belief is like every doctor that can use lifestyle prescriptions, it takes 1 minute. They
hmm
can take longer, right? But it's just spending that 1 minute with
Yeah,
every single client and giving them lifestyle prescriptions. It can be as easy as, until you come back next time into my practice, you start doing yoga, you
right.
meditate, you get a teacher, you go to someone that can help you with your anxiety. I mean, it's not like a doctor would have to learn all this because I think that would take many, many years. But being that authority,
hmm
where we not just do handle disease management, but actually send them to somebody like you.
hmm
I think
Yeah, I
that
agree.
that is where the healthcare system has to go, because you're totally right. I mean, it has to shift, and we hope that lifestyle prescriptions is that part, because I think it's doable. It's doable for every doctor to spend 1 minute with a client and giving them positive encouragement.
Yeah, I think it's a wonderful idea, and I hope that it's not necessarily the doctors that are open, but if the patients are more and more looking for something, usually, doctors will also more respond because it's also a question of demand, and we
Both ways.
as patients, we need to be the one who also say, you know what, this is something that I'm looking for, a doctor who sees me as a whole being and not just sees my liver as this is who I am. And, I think that consciousness shift will also shift the Western medicine paradigm.
So, call to action on everybody that has health issues, all the clients and patients out there, take responsibility.
Definitely.
Here
Definitely.
we go.
But don't take blame. That's sometimes
Exactly.
the tricky part. And we can do a whole show about that. But it's basically sometimes the responsibility makes people feel like, okay, so I'm responsible for my cancer. It's my fault. And that's not what we are talking about. We are
Exactly.
talking about responsibility for your healing, knowing, believing, trusting that your body, who has kept you, not only alive, but healthy and well for most of your life, can also heal you from the inside out. And that's something that I think is really an empowering perspective. And I have seen many, many times how just that shift in thinking is really changing the state of where the people are in, and makes all the difference, because then they are motivated, then they are actually looking forward to the healing, they are feeling there's something they can be actively involved in. It's a beautiful collaboration then.